Do you want to know how female sexual dysfunction can cause infertility? If you want to find out more, watch till the end of this video. I'm Dr. Malpani. I'm an IVF specialist and have been running Malpani Infertility Clinic in Mumbai for over 30 years. One of the things which we often don't talk about is sexual dysfunction, because in general sex is a taboo topic, carries a social stigma. There's so much misinformation out there that it's very hard to differentiate between what's right, what's wrong. Patients don't know what is right because they're often sexually inexperienced in India. Doctors aren't very interested. There aren't that many sexual medicine specialists. A lot of gynecologists couldn't care less about sexual dysfunction because it's not their area of specialization or interest, as a result of which a lot of couples with sexual problems get a very raw deal. This is especially true for female sexual dysfunction. One of the most frustrating problems which women have is called vaginismus. As the name suggests, it's an involuntary spasm of the vaginal muscles. What this means is that for some reason they're so scared, petrified, terrified at the thought of allowing vaginal intercourse or allowing the entry of an erect penis into the vagina that they just clamp up. They bring the thigh muscles so close to each other that there's no way the husband can separate them or insert an erect penis inside the vagina, as a result of which he cannot ejaculate inside the vagina. If there's no sperm going in the vagina, there's no way she's going to get pregnant, which means this sexual dysfunction results in involuntary childlessness. Not infertility, because she has no fertility problem. Anatomically, everything is fine. Physiologically, everything is fine. But it's an involuntary mental problem which prevents her from allowing this normal physiological activity to occur, which is very frustrating for the woman. She can't understand why. She can't do what all her friends merrily do without any problem at all. She can't talk to anyone because she's embarrassed, she's shy. She tries to look for information, but there's not that much information available even online about vaginismus, so she doesn't even know what the right word is, so how does she find it? She'll look up things like pain during intercourse, which is called dyspareunia, which is a completely different problem. And the poor husband, he doesn't know whether the problem is because he's not a good sexual lover or whether his wife doesn't like him. And obviously it's the elephant in the room which no one talks about, because she's ashamed and embarrassed and he doesn't want to rape her and he doesn't want to push beyond a particular point. So the poor guy is stuck, and so is she. The good news is there is a solution for this problem. You need to understand what the term is. It's called vaginismus. You can read a lot more about this problem on our website, which is www.drmalpani.com. And the reality is, a lot of couples say, I'm not so worried about my vaginismus problem or about having sex. We're perfectly okay with what other people would call a sexless marriage. It's a sexless marriage. It's not a loveless marriage. We love each other. We're happy. But we want to have a baby. So can you just fix this for us? And the good news is we can. In the clinic, the procedure is something called an artificial insemination, which can actually be quite hard for the woman to do because she's so petrified and scared to allow a gynecologist to put a speculum inside the vagina that she won't even allow this. And then gynecologists can be quite cruel and unkind, and they say, oh, your vagina is too tight or it's too narrow, or they come up with horrible, completely obsolete surgical solutions like actually making a cut in the vagina, which is terrible. People should have stopped doing that 50 years ago. Barbaric solution and doesn't help and actually makes problem worse. And they advise things like Fenton's dilators and stuff which don't work very well either. You want to find out what works? Go to our website. But much more important than that is that at the time at which you're ovulating, your fertile time, you need to do what is called a self-insemination. And you can do that in the privacy of your own bedroom. And the good news is you can buy a self-insemination kit. It's available online at our website at www.drmalpani.com, so that you can bypass the problem of the vaginismus. So you can track your ovulation and during the fertile time, ask your husband to ejaculate in the container, and then allow the semen sample to liquefy, and then use the sterile pasture pipette we provide. So you can put the sample inside your vagina and you can happily have a baby, even though you haven't addressed the underlying problem of vaginismus. Addressing the underlying problem is not easy. It's a deeply rooted psychological issue which can take time. But getting pregnant in spite of your vaginismus using self-insemination is so much easier. And at the end of the day, if all you want is a baby, why not just go ahead, take the shortcut for yourself? And we are happy to help you to have a baby. See you on www.drmalpani.com. Send me an email and I'll tell you how we can help you to have a baby in spite of your problem of vaginismus.